Thank you, Gina, for those incredibly inspiring words and positive call to action, for all your great work at EPA. And we are so excited you're back here in Boston. Thank you also to the Boston University School of Public Health and to all of you who've come today for this timely and important symposium. I'm Fallon Lambert. I'm the director of the Science Policy Exchange at Harvard University, and I'm moderating our next session. So the focus of our next session is climate and health impacts and opportunities. And I think we just heard how important it is to view these opportunities and to grab them for positive change. We are going to have a keynote talk followed by 4 panelists, 2 journalists, and 2 municipal officials who are leading the charge to bring knowledge about health and climate into the public sphere. As we listen to our speakers, I invite all of us to think about how we can learn from their examples and how we can change our system of research, public engagement, and science communication to inform and accelerate action. We're going to kick things off with our keynote speaker and welcome Patrick Kinney, the Beverly A. Brown Professor for Urban Health at Boston University School of Public Health, back to the podium. And after Pat offers his remarks, I'll introduce our panel. Thank you.
Thanks, Kathy. I think I made a mistake in planning the agenda a little bit, putting myself right after Gina McCarthy. That was a really dumb thing. So I'll learn from that experience. One difference is I'll have some slides and so I'll be a little more, sort of the typical scientist in my presentation, and you can sort of compare and contrast the communication styles. I think it'll show sort of where we need to get to as scientists. So I'm going to talk a little bit about the connections between climate and health, just to kick this off. It's a complex issue, and I'll give you a little flavor for some of the complexity of it, but try to hit on some of the main points. And really, it's just fleshing out some of the things that Gina just talked about, really. A lot of times when we talk about climate change, we focus on temperature. We see graphs like this, which is showing time along the x-axis. You may not be able to see the x-axis, but it goes from 1880 on the left side to 2020 on the right side. And those are actual measurements. So the last measurement on the right side is 2016, actually. That's showing the average temperature on the globe measured since we really have good records in 1880. And you see that there's a sort of steady upward tick. And scientists will look carefully at the data. And really, it's since about 1950 or so, when there was kind of a little downward thing. After that, it's been kind of going up steadily. And that's the period that scientists are convinced that human activity, especially fossil fuel combustion, has really driven the story. And if we now take the observations and project them into the future, this is going out to 2100 now, climate models tell us that further warming is inevitable, but how much warming is very much in our control. The lower blue curve is a whole bunch of models that have been run using low greenhouse gas emissions. So like if the Paris Accords and even further controls are implemented, we could get onto that trajectory. If not, we'll be on something more like the red trajectory. But this is just temperature, and I wanted to point out that the climate system is much more complex than simply temperature, although temperature is a handy metric. Just like we measure temperature of our bodies, and a fever is an indication that our body has some kind of disease process going on. Likewise, temperature is an easy to measure thing about the planet, but it doesn't really represent the complexity of the problem that's occurring. So if you really look at the climate system, it's a much more complicated thing. It involves the oceans, it involves the atmosphere, the biosphere, soils, lots of chemistry, lots of physics. And so that ends up, so temperature is certainly one of the things we worry about. Temperatures are warming up, but there's lots of other changes. And precipitation changes, changes in the patterns of rainfall is one of the things that is hardest to predict, but potentially most impactful. We have increasing drought in some regions that are very sensitive to drought, where agriculture is being impacted. We have other places and other times where extreme rainfall is causing flooding and forced migration and refugees and conflict. And this is a picture from one of the nor'easters we had in Boston just last month, showing one of the coastal communities along Boston. Sea level rise is exacerbating the problem. As the ocean is rising, coastal storms, which are also getting stronger, are having a bigger impact on coastal communities such as Scituate, which is shown in this picture. Climate change is very intimately connected to air pollution, as Gina pointed out. And one of the important motivators for change is really air pollution in global cities. Here's a picture of Beijing. I don't know if you've been there, you've seen this interesting building there that the Chinese affectionately refer to as short pants. It's like this kind of weird, it's a really, really big building. It's hard to tell from this picture. That's a picture of Beijing on a dirty day. Mexico City's in a valley, and it's had chronic air pollution problems. Delhi recently has had some of the highest air pollution levels of any place in the world that have been measured. Actually, Beijing's getting better, but Delhi's probably getting worse. And it's not just a global problem. Even here in the United States, we still have issues. And here's another Houston reference, the second one of the day so far, showing a smoggy day in Houston. Houston is occasionally plagued by smog pollution. So pollution is a big global problem. It's responsible for a very large burden of disease, as Gina McCarthy pointed out. Something between 5 and 7 million deaths a year are thought to be promoted, sort of become prematurely occurring because of air pollution exposures. These kinds of city levels of air pollution are particularly impactful in that regard. How does that relate to health? Well, there's a lot of research that we've been doing over the last couple of decades looking at impacts of extreme climate events and also sort of more complex climate-related outcomes. Heat stress, which is up there on the upper right-hand side, is the thing that we've studied the most. It's most direct impact. People die in the summertime when temperatures get really high, especially older folks and people that are sick to begin with. Also, extreme storms like hurricanes cause a lot of immediate impacts, but also longer-term impacts, including mental health issues that occur. Allergies and pollen are changing. There's pollen seasons are occurring earlier now. They seem to be lasting longer. And actually, CO2, which is the major driver of climate change, is a fertilizer for plants and actually makes ragweed put off more ragweed pollen as well as trees seem to be doing the same thing. Then we get to some more complex issues like the air pollution problem. There's an intimate connection between air pollution. We'll talk more about that in a second. Vector-borne diseases such as the spread northward of the mosquitoes that carry dengue and also Zika virus are particularly alarming. And children with asthma related to the air pollution issue is another concern. And these are things that we've been able to study and we have some data on. But there's a lot of more complex ways that climate may impact health especially through these changing precipitation patterns, changing agricultural practices, nutrition, conflict, migration, those sorts of things, which are much more complex, haven't been really quantified, but could potentially be some of the biggest effects. So as we think about what to do about climate change, we have basically, as society, we have two approaches. Climate is changing. We need to adjust, adapt to what further changes are going to be occurring. But meanwhile, we need to work quickly, urgently, to mitigate, to reduce our impact on the climate system, and basically to reduce the concentrations of the greenhouse pollutants that are causing the problem. And I'm going to focus, so a lot of the adaptation stuff relates to those impacts that we just talked about. But I'm going to talk about mitigation for the next few minutes, which I think is a key focus. And it's interesting, if you look in the health literature, particularly in the Lancet Journal over the last decade, there's been some provocative conclusions that have been stated. Back in 2009, I think it was Andy Haynes that said, if properly chosen, action to combat climate change can, of itself, lead to improvements in health. The news is not all bad. And then more recently, the Lancet Commission report made this even stronger statement that tackling climate change could be the greatest global health opportunity of the 21st century. So what are they talking about? Well, basically, they're getting at the ancillary benefits or dividends that come for health from action that we take on climate change. And this is a slide that I borrowed from Kathy Lambert, who is our moderator, showing one illustration of how that operates. So we might want to mitigate climate change by going after the fossil fuel emissions that are creating the carbon dioxide. And that's affecting carbon dioxide, reducing it, and reducing our impact on the global climate. But meanwhile, those same sources are emitting what we call co-pollutants, things like sulfur dioxide and nitrogen oxides, particulate matter, which are directly impacting in the very local environment and very immediately the people's health in the local, in the United States and in other places where those sources are located. And that's impacting health through cardiovascular disease, through asthma, through increased hospitalizations, premature deaths, lung cancer. And so we can avoid health effects proximally by taking actions that are good for the planet. And so that's the mitigation health dividend story. We've used that information in a few cases to really justify important regulations. The Clean Power Plan, which was proposed by Obama about 4 years ago, I think, and has been controversial in the news in the last year or so, did a really interesting cost-benefit analysis. The red bar there is the control costs for implementing the Clean Power Plan, which would have reduced power plant emissions across the United States by about 30%. They quantified health benefits and also climate benefits. The climate benefits relate to sort of the global benefits of a less climate change, but the health benefits were really around air pollution and the cardiovascular disease and the asthma. And the health benefits actually were very, very large, and together the climate and the health benefits far outweighed the control costs. So this is an example of how health benefits of climate mitigation can really be very impactful. But it's not just about air pollution. Air pollution is one of the ways that carbon-free cities can be helpful, but there's a lot of other ways. We can provide more green space, which provides places for people to go. It also cools the local environment. We can enhance environmental equity, promote physical activity, promote psychological well-being. Social capital increases as we provide people with outdoor spaces, build resilience to climate extremes, reduce noise, increase access to healthy foods, especially locally generated foods. All of these kinds of, this suite of actions and impacts can bring climate benefits as well as health benefits in local areas. And cities have really been taking the lead in some of this stuff. If you look around, Boston's been a leader at setting this incredible zero carbon goal for 2050. There's alliances of cities around the world that are doing this. Seattle and San Francisco, New York, many cities have been really taking the lead. And it kind of poses the question, why? What is it about cities that makes them so well positioned to take leadership on this issue? And I mean, and these are some of the reasons that we can think of. First of all, a lot of people are there in cities, increasingly. So they also are responsible. Cities are responsible for a lot of carbon emissions, and again, increasingly so. But they're also very highly vulnerable. So people living in cities are highly aware, through heat waves, through coastal storms, and through air pollution, of the negative impacts of climate change. And there's a lot of activity and innovation that's focused in cities. Universities are located there, and innovative governance. And governance that is more practical and often less politicized than we find at the federal level. So I think all of these reasons kind of play into why cities are really the leaders at this point. And just one example, we're working with the Institute for Sustainable Energy here at BU to map out different strategies for achieving Boston's 2050 low carbon goal, or zero carbon goal, through buildings, through transport, through waste. And this is a diagram that the Institute for Sustainable Energy provided that shows the modeling system. But far at the right side, as we take the outputs from all that, we can look at the health impacts through improved air quality and also through improved mobility, active transport and things like that. And so John Levy and I are working with Cutler Cleveland and others at the ISE to look at those issues. So finally, I just wanted to summarize. These are some of the takeaways that I want you to keep with you throughout the day as we have our discussions. First of all, there's an urgent need for action. We need to get onto that lower future, the one that was that the climate model suggests could avert some of the worst consequences. Secondly, cities are leading the way. Third, there's substantial health dividends that can be achieved through taking action at the urban level. But I think we feel like we need to communicate better about that. We need to find ways to get the public informed and also public officials knowledgeable about these health benefits so that they can really take them into account in their planning. Thank you very much.
So we're going to hold questions until the panel discussion to keep things moving. So what I'm going to do next is introduce all four of our panelists in the order that they'll appear. The panelists have a slim 8 minutes to give their remarks. When you see me stand, you have about a minute left, and we'll try to really keep people on time so that we have enough time at the end for discussion. After each panelist speaks for their 8 minutes, then they'll all come up here for what we hope will be a 20-minute discussion before the break. So I have the pleasure of introducing the following four people. Starting, our first speaker will be Austin Blackmon, and their full bios are in your programs. And Austin is the Chief of Environment, Energy, and Open Space for the City of Boston. He'll be followed by Hannah Fairfield, who is the climate editor at the New York Times. She will be followed by Barbara Ferrer, who is the director of the Los Angeles County Department of Public Health. And we'll end with Joanne Silberner, who's an independent journalist and artist in residence at the University of Washington, and many of you may know her as a former health policy correspondent at NPR. So please help me in welcoming Austin Blackmon.
Good morning. Thank you so much for having me today, and thanks to BU for hosting this wonderful event. I am originally from Chicago, and I mention that because I grew up during the days of the Chicago Bulls and really hoping to be the point guard for that team one day. Now, why am I telling this story? Because Michael Jordan was my hero. And you know, maybe a year or two ago, I realized that that growth spurt wasn't going to come through. And I saw Gina McCarthy speak for the first time. And I think that we all understand now that when I heard her say that working on environment is a public health issue, that I got a new hero, and you see why. So, I'm from Chicago. I'm assuming, quick raise of hands, who here is from Boston? All right, almost everybody. So, almost everybody should recognize that this is what Boston looked like 400 years ago. This is why we get to work on climate change, why Boston is so vulnerable, because 400 years ago, about 30% of Boston was in the harbor. Our predecessors came to this city, they recognized that it was a great marine port, and the city started thriving to the point that they needed to add more land. So they filled in the harbor, and they did it in a responsible way. They made sure they did so above the highest high tide that they had seen at that time. But over the past 100 years, we've seen about 10 inches of sea level rise already. And so now when we have these astronomical high tides or king tides, you might hear it on the news or the weather reports, we're starting to get daytime flooding in parts of Boston. And so as we are seeing our projections, we recognize that maybe Boston can look much more like it did 400 years ago if we don't do anything. This is what some of those projections look like. 2030, parts of South Boston are now in the FEMA floodplain. Many parts of East Boston as well. If you look at the mid-century, basically all of those areas double. By the end of the century, now we're talking about severe impacts. Even the monthly high tide reaching as far inland as some of our landmarks like Faneuil Hall. Again, for those of you from Boston, you'll recognize Kevin Garnett. The reason why I put him up there is because our projections show that if we do nothing, we could have up to 7.5 feet of sea level rise. I know I'm getting a little bit too much into basketball, but for those of you like me who have had a chance to stand next to Kevin Garnett, it's a conversation like this. It's unbelievable what the challenges we face if we do nothing. But as much attention as sea level rise gets, as Administrator McCarthy was talking about, we often forget that heat and the impacts on public health can be extraordinary as well. Our projections are that by the end of the century, we will have 90 days over 90 degrees Fahrenheit, basically the entire summer in the city of Boston. My grandfather's from from Brettenburg, Alabama, a small city between Mobile and Birmingham, Alabama. I've had a chance to be down there in August. I will tell you, it is not pleasant. It's very, very hot. I'd rather be on the Cape or I'd rather be up in Maine. But that's where we're on pace. What does that mean from a public health perspective? Our projections are that if you have an illness that can be exacerbated by heat, whether that's lung disease, heart disease, diabetes, asthma, all diseases that I guarantee you, if I asked everyone in this room, you know somebody that's impacted by one of these that lives here in Boston. If you have one of those by the end of the century, if we have the heat that we're projecting, 3 times more likely to suffer a heat-related illness. This is why the work that we're doing on climate change is a public health issue. So what are we doing about it? Not only are we studying how we can get to carbon neutral, as was mentioned in some of the other slides, and looking policy by policy, what are the most efficient, cost-effective ways that we can make Boston a carbon neutral city, but we're also looking at the ways that we can protect our neighborhoods from sea level rise to ensure that some of our neighborhoods that are particularly vulnerable from a public health perspective are also not as at risk. So take, for instance, East Boston, one of the areas that we've gone and understood to develop these shovel-ready projects. East Boston has multiple challenges. No trauma center over in East Boston. Multiple senior facilities. If we have a flood or an event at the level of a Superstorm Sandy or Hurricane Katrina, how do we prepare the city to ensure that those residents are able to make it through that storm? The work that we do by understanding where these vulnerabilities are is passed on to our Office of Emergency Management so that we update our evacuation plans, that we update our emergency response plans, so that from a public health perspective, we can protect our residents as well. Here's just another zoom in to help you understand what that means for a place like East Boston. We've got some of the flood pathways mapped out there, but then we wanted to take that and then turn it into a long-term vision for protecting it with open space. So not only do we get a chance to protect our residents by putting in things like a deployable flood wall in the East Boston Greenway that'll protect most of the neighborhoods, it's up to 90% of the neighborhoods up to 2030, but in addition, we provide this vital open space where people get a chance to go out and congregate and experience the water and the waterfront that we've spent literally billions of dollars cleaning up. And so with that, I thank you very much for having me and look forward to the rest of the panel.
Do we have Hannah? Great, thank you.
Thank you so much for having me here today. The first thing that I want to do today is do a quick poll. So if you want to try to fix the climate puzzle, here are some really excellent options. Can everybody see those? Option 1 is build more wind farms. 2 is eat less meat worldwide. You can improve air conditioning, and you can switch to mass transit. These are all excellent solutions. And I would like to know, a raise of hands, who thinks that building more wind farms, globally, widespread, is the one solution that is really the biggest impact solution? Raise your hand if you think it's wind farms. All right, raise your hand if you think it's eat less meat worldwide. Raise your hand if you think it's air conditioners. Raise your hand if you think it's mass transit. Good solutions all. Team air conditioner, you win. Fixing air conditioning, fixing the pollution that comes from how we cool our planet as the planet gets hotter is one of the most direct and influential places that we can focus on right now. A lot of you did not raise your hand for air conditioners, and as a journalist at the New York Times, one of the things I want to do is to surprise people and to teach them things that they didn't know before. So I'm really interested in where we can find surprise. So one way to do that is to lean on the data, to bring data in ways, new data and new ways to share our stories, to share the story of data. So Team Climate, which is what I like to call the new climate desk at the New York Times, we created that last year, just a little bit over a year ago. And that is a really good evidence that the Times itself is focusing on the story, is focusing on climate and public health and environment in new ways. And they put a new investment into creating this team. They asked me to be the editor of it, and I spent last year building the team to focus on things. So one of the first things we did last year was to do a story about early spring. Last year, spring came enormously early to the East Coast. And we created this data visualization that showed exactly how early spring came. And a lot of places, it was a full month early. And we did two pieces, so this is another data visualization. So I wanted to show how it compared to the 30-year average, because climate scientists often think about climate changes in 30-year increments rather than year-on-year or decadal. 30-year is a really important metric to be able to use and measure. So what I wanted to do with this is to show people how different last year's spring was to a regular 30-year average. And you can see at the end of February, it was really remarkably dramatic. Did it arrive early? Indeed. This year, did it? No. So why is spring arriving early? Well, the world is getting a lot warmer. And this is what warmer looks like. This is the days per year above 95 degrees. So Austin mentioned heat in Boston, and you can see the East Coast of the United States, but you can also see all across the world, there are large stretches of geography where 200 days out of the year are going to be above 95 degrees. Lots of people live in those areas. There are some hot pink areas in the United States. Phoenix, areas of California, they're really at risk for extreme heat. So it's not your imagination. Summers really are getting quite a bit hotter. The pink map that I just showed you was a climate model that was forecasting forward. We talk a lot about those. And I think bringing climate models to our readers is really important. But I also think it is equally important to show people what's happening within their lifetimes. So this is a histogram that shows how much the histogram of temperatures has actually changed within our lifetimes. This is summer temperatures just in the northern hemisphere. And the original histogram you see is 51 to 80. A few people here might have been born 51 to 80. And you can see now how that histogram has changed. Look at how the extreme red has changed. So the likelihood, the frequency of extreme heat has become so much more common in that histogram. And yes, we still get incredibly cold winters sometimes, like this one, but the likelihood of that is getting much, much smaller. Our brains are incredibly good at seeing visual trends. I hope that you learned something from that histogram that you might not have otherwise. And we're incredibly good at seeing visual trends in mapping. And so we can use that, I feel like, to reveal a lot of data that can surprise readers. So this is another piece that we did last year. And I think about this set of maps quite a bit when I think about what I want us to do and where we should all be thinking. So if you look at the map that's more orange, this is polling data from around the United States. And it asks people Do you think that global warming will harm people in the United States? And we colored it so that the blue is below 50% and the oranges are above 50%. So below 50%, they think that global warming, it will indeed harm people within the United States. People have a concept that global warming is in fact dangerous, that it is harmful. But the second map is, will global warming harm me personally? And that map is overwhelmingly blue. People do not think that it will touch their lives personally. And I feel like that is why we're here today, and that is why I think that there is so much good work to be done between the space of those two maps. Because the more that, obviously, readers can understand what data reveals, the more that they can really understand the world around them and how it's changing and what can be done to fix that. Thank you.
Good morning, and I want to just thank everyone for being here today, especially thank the Dean and all of the wonderful panelists. I'm honored to be back and thrilled that we're also focusing on what I think is one of the most important public health issues. I'm going to talk a little bit from the perspective of, as somebody who works in a local area. I work in the county of LA, although it's a pretty big county. And I'm going to run through these pretty quickly to keep to my now 8 minutes. But we worry a lot about thinking about how climate change is really affecting the people we're in service of throughout the county. We worry about the fact that climate change affects both the severity and the frequency of illnesses we're already seeing, but also that it gives us a great pause because we see emerging illnesses that we haven't expected in places where we weren't expecting to see them. In LA, by the way, was one of the places, if you didn't catch that because you're not really sure about where it was in California, we are one of the places where people are actually very aware of climate change. People are very worried about hotter temperatures already, worse air quality, and again, we're one of the leading cities and counties across the country with high rates of pollution. We see more acres of burned areas because of an increase in wildfires, and very worried about what it's doing around precipitation and water quality. And it's pretty obvious when you look at our data already, the limited data that we have, that in fact you see the impact of for the increased heat days. And you see that by both an increase in emergency department visits because of our heat, hotter temperatures, and in terms of hospitalizations. In terms of fires, we had the most destructive wildfire history ever in California. In the Southern California region alone, in December, we saw 29 wildfires, and that the cascade of these events is profoundly damaging and destructive, and well recognized by many people who live in the area. How well they connect that with climate change, I think, is the topic for discussion today. But we had an unusual extreme heat in December, Santa Ana winds that we don't usually see at that level, led to a lot of wildfires, increases both our ability to see more erosion and also higher emissions of particulates. That was followed by heavy rainstorms, again, very unusual, both in duration and the nature of the severity of the storms, led to destructive flooding and mudslides. We had huge damage to homes, to the ecosystem, and to lives. And that also has a cumulative effect around sort of the diseases that we were seeing in terms of visits to emergency rooms. So you had the acute phase of this, and then you have sort of the lasting impacts of that kind of destruction of an ecosystem in your community. The other place where I think we, like many other local environments, see a profound difference in what we're experiencing around the health and well-being of our residents is what we see around vector-borne diseases already. And again, higher temperatures is leading to a change in mosquito populations. And what we saw last year, which wasn't necessarily an unusual pattern except for the extreme nature of it, was what we've been seeing for the last few years, which is an increase in West Nile virus cases. And we see both an increase in cases, and we increased the duration of capturing both infected mosquitoes with the virus and the virus showing up in individuals. So we added about 2.5 months to the duration of the West Nile virus season in LA County this year, which of course led to an increase both in deaths and in people who were showing up infected. And as others have spoken before, unfortunately, vulnerability for the impact of climate change is not equally experienced. And I'm going to highlight this a little bit, and it may be somewhat controversial, because we want everyone to worry about climate change, and everyone can contribute to solutions to climate change, but some populations are, in fact, much more affected by climate change than others. And so we've talked a little bit about residents who are vulnerable because of their health status. I want to talk a little bit about residents who are vulnerable because they're marginalized, oppressed, and stigmatized. And I want to talk about it in terms of what it means for a public health response. Because like other large jurisdictions, we have a climate action plan. We really benefit from a very progressive government in LA County that pays a lot of attention to this and insists on full integration across all of the departments. So we get to work a lot with the Department of Public Works, with regional planning, with transportation around making sure that we're able to implement an effective climate action plan. And there's nothing really on here that I don't think you've seen in other action plans from cities. And it leads us to some what I call traditional actions. We produce a lot of informational materials. We're training our staff. We're engaging with partners, both in the departments and in our communities, to do planning around climate change. We do things like plant trees. We work a lot on reducing carbon emissions. We have very aggressive county policies around moving to electric cars. We have what we call flex time, so that people are working alternative work schedules so they're not having to get on the roads. We're working to improve mass transit and active transportation in all of our communities. But I would say what we're not necessarily focused on is the issues around equity. Here's what I'd like to sort of leave us with is that there are some other steps we need to take to address the fact that it's not exactly an equal playing field right now in terms of vulnerability. One is we need to really think about the inequitable distribution of diseases already. That we have some populations, they're generally our people of color and poor people, who have much higher rates of chronic diseases such as asthma and cardiac and pulmonary diseases. And those will actually worsen with any impact of climate change. So we need to actually reduce those inequities and be forceful about steps that we take to reduce those inequities, which I think actually are tied in nicely with strategies to reduce carbon emissions. So I don't think there's a disconnect, except that we need more focus on populations who are already facing an adverse outcome. We need to address the chronic underinvestment in some of our communities in infrastructure. And what that's resulted, what the results have been of that chronic underinvestment. Less park space, less green space, huge problems around water, access to water, clean water, storm water, really paying a lot more attention to sort of the walkability issues, the connections between where people are living and where jobs are, and how people will get to those jobs. Because it's generally the lower income residents, lower income workers that end up now living further from their work sites than ever before, and really have to rely heavily on using their cars in order to get there because of the lack of a public transit infrastructure that connects people to where they're working. We need to ensure that when we talk about the effective management of our parks and our green spaces and our natural world, and we talk about investments in a built environment that is friendly, creates a friendly ecosystem, we make sure those investments are happening in all communities and not just our wealthier communities. And lastly, from a public health perspective, we need to do a better job on our surveillance and capturing information about the vulnerabilities of some populations and being able to use that to actually help us direct resources as appropriate. So I thank you very much. I'm looking forward to an exciting conversation and really happy to be here today.
Hi, thank you for coming. I'm Joanne Silberner. And I'm going to first start by telling you a little bit about myself, and then I'm going to invite you into the process of getting a climate change and health story. And about myself, I'm just going to tell you the stories that I did for NPR on climate change, to give you some context. I did one on potato farmers learning to grow different species as the weather changes. Did one on watching for cholera return in the warm waters off of Peru, which is expected to happen. And if you heard a story about climate change and cacao in Brazil, that was me. Now I'm a freelance writer, though, and that means my initial audience is editors. In order for me to get a story on climate change and health in front of the public's eyes and ears, I've got to convince an editor to take it. And by the way, for those of you who do want to influence the media, editors are the best place to start. They're the big ticket. I'm, as I said, a freelance reporter. I look for stories that I want to do. And my definition of stories that I want to do are things that get me angry. Climate change gets me angry. Lack of attention to mental health gets me angry. And I couldn't really figure out how to put the two together until I started looking around for research. Who's done research on the mental health effects of climate change? And scan the literature, talk to my husband, who's a climate change guy you'll hear from later, and found that most of the interesting work, or most of the work, had been done in Australia, and in Australia particularly. So that meant travel. Travel to me means the Pulitzer Center, which very kindly funded me to visit Australia and Fiji and look for stories on mental health and climate change. Now, the way my approach to stories comes from Amy Goodman, a journalist who said, go to where the silence is and say something. My guess is you haven't seen much in the media about climate change and mental health. It's a tough sell. And Alex Chadwick, an NPR reporter, had another story, another quote that I like. He said, if you're a reporter trying to tell a story and you're in a crowd of journalists, you're in the wrong place. So, great. So Australia, Fiji, got a grant from the Pulitzer Center, which made it possible for me to sell these stories. You know, if I went to a place and said, I want to spend lots of money and go to these places where things are actually happening, they'd look at me and say, we don't have the budget. But with travel money, I could do it. And I went to PRI's The World, came back to the Pulitzer Center and said, hey, here's somebody who's going to run these stories. And they said, go and do well. So the stories that I did out of that series, I looked at resilience. I wanted to do something on resilience. Well, stories are about people. So the person I found to tell the story about resilience was a firefighter outside of Melbourne who had been involved in the horrific Black Saturday fires. And he came out of that experience saying, we're going to be seeing more of these fires. Nobody knew what to do. We've got to get people ready, and we've also got to get them mentally ready. You know, if you're ready for something, if you're ready for a disaster, it's that, you know, that little bit easier that can make all the difference in your mental health coming out of it and whether or not you get PTSD. So he was training kids he had a classroom. He went from classroom to classroom and trained kids what to do during a wildfire, where to go, you know, where to shelter, which way fires move. He felt that education was going to help him, so I did a story about him. Australian farmers are deeply, deeply affected by these fires and these droughts that have been ravaging New South Wales and Victoria and other parts of the country. And I went around and I talked to farmers and focused that story on a guy who headed a self-help group for farmers and who had depression himself. And I didn't realize until I got there that he was a total climate change denier. He was getting himself and the other farmers in his area ready, but they weren't admitting. He said, well, the weather's always changed in Australia. That's our history. He was able to get ready without even accepting climate change, which astounded me. And then stories localization of stories is incredibly important for various outlets. So for the Seattle Times and for KUOW, the local public broadcasting station, I did a story on expats from Fiji who were living in Seattle with the plan of, you know, making enough money to go home and have a nice retirement on this wonderful, wonderful island called Totoya. They were in the process when I talked to them of figuring out they weren't going to be able to go home to the same place. One of them said to me, my mother called me the other day and said, can you send me a sweater? She said, a sweater in Fiji? She said, this is unheard of. And another one told me about how the last time he had gone back and he went to visit his grandfather's grave and it was underwater. And they were really, so it was the psychological effect for them of not being able to go back. And then I talked to the head of the chief on the island who was saying, no, we want these people to come back. And I said, well, what about climate change? And he's like, Gina McCarthy, we'll figure it out, but these people need to come back. But again, what made that story a saleable story was that it was a local story, a way to localize it. And then for Grist, I did a big picture story, a talk piece about all the people I talked to and all the climate change research I was able to look into while I was there. And I did some stories like that for the Pulitzer Center website as well, you know, on my trip and what I learned. Now, there's stories that I couldn't sell from that trip. One was that I had been working with one editor at PRI, and he left to write a book. So I had one last story to sell. It was about a small village I had visited on one of the bigger islands of Fiji that was on the water, and they were in the process, with the help of the government, was helping them as a test case move up the hill. And they needed to move up the hill because the water was coming in. And it's a very different life if you're on the water or up the hill. It doesn't, you know, they're still on the same island, they're still together, and that's all good, but it's a very different life. Everybody in the town was really, really, really upset about this, except for the chief's wife, who was very happy because she was just tired of washing the mud off of the walls of their house every time it flooded. I couldn't sell that story, though, to the editor because he said, you know, we've done all these stories about places having to move. And I said, well, yeah, but this is a different place, and, you know, this is it's still happening, you know, but that's one story with the way some people perceive news, is that it has to be new. My feeling is if it's a different place and it's still happening, it's news. Wasn't able to sell that story to him. And another story that I couldn't sell was I visited this town that was in the middle of the Black Saturday area. That had been really devastated. It was this wonderful town. It was a lot like Santa Cruz, California, a bunch of old hippies living together and just having a good life. And then suddenly half their town is gone. There were a couple of hundred deaths in that fire, a lot of them localized in this town, and they were trying to figure out resilience. You know, how do they come back from this? And all the social workers were coming up from Melbourne in there. They said, we knew them because they had high heels and briefcases. And they figured out pretty quickly, we're not going to listen to the high heels and briefcases. There were a lot of community activists in town, and it was a very politically active town. They knew what to do. They got together, and they had local meetings with local people and just sort of self-help meetings to talk about what had happened. I don't know why I couldn't sell. The other story I couldn't sell because it had happened before. This story, I had a local angle. I took it to some California publications thinking they've got to figure out what to do after their horrible fires. You know, maybe they'll want to know what somebody else did. Didn't sell it. So what I learned, you know, well, of the stories that I was able to sell, they were all focusing on people who were affected. And in a terrible way, it's good news now because more people are being affected. There are more stories to tell. You know, finding a firefighter, teaching a class on resilience, finding people doing things that gives journalists something to talk about. So that's something that's changed over time, is the idea that it's a little bit easier now because we've got real people involved. It's bad for the world, but it's good for journalism. I'm going to end, I don't know how I'm doing on time, but I'm going to end with something that usually takes me an hour to give in a talk that I've given many times, and that's because I know there are scientists in the audience, and I want to talk a little bit about what you can do if a journalist approaches you, how you can get your story, out there. One is if a reporter approaches, be available, and if you're not available, tell them when you'll be available, or tell them someone else who might be available. But two, which should have been point one, which is always know who you are talking to before you talk to them. Google them. If you've got a public information officer, talk to the public information officer, but know who you're talking about always. And and be an active consumer of the media. When you see stories you like, letters to the editor, compliments to the reporter are always accepted. It's, again, the reporters out there, especially freelance ones like me, and by the way, I should say I'm an N of 1. If I'm a staff reporter, I'm listening to what the editor wants. But reporters like us do like to know feedback and whether what we're doing is helping. Thanks.
Hats off to that group of panelists. They did an amazing job sticking to time limits, being very gracious about it. And because of that, we now have time for a robust conversation before the break. So I invite all of our panelists and keynote speaker back to the stage for a conversation. So you now all should be readying your questions. And when you have a question, please stand and introduce yourself, just your name and where you're from. And you can either direct it to an individual person or to the group. But to kick things off, I had a question to all of you. We heard about, from Gina McCarthy, how important it is to talk about the positive benefits of climate action to people, and that it's about health and people in the end. And this is a great opportunity. We heard from our talk today a lot about what's at stake from climate change and health. So what are your thoughts about how much traction we can get by articulating the benefits to people of acting on climate? And we can just go.
Sure. I'm happy to start with that. I think that this also follows up some of the comments that you just made. I think that where we are still struggling as communicators on climate change is putting a face to the story. Really making it personal. And I think Gina does that better than anyone else that I've seen. But really, I think that even in the literature and the science, that we still haven't been able to, as effectively as possible, say that these people in these areas, as a result of the actions that we are taking through polluting our environment, through releasing emissions, that we are seeing these impacts today, that we are seeing people that are being forced out of their homes, not just abroad, but even here in the United States after major hurricanes or otherwise, and tying that to climate change and tying that to the impacts that we see as our public health infrastructure really has to struggle with that as we see more people in hospitals. That's not what is in the news. What's in the news is the dumpsters going down the streets as we get flooding in the city of Boston, and that is important. We need to take action on that, but we still haven't put that face to the impacts of climate change, and being able to articulate that in a more effective way, both through science and also just through effective story making through the media, is something that we still really need to make progress on.
Others?
I talked a little bit about surprise earlier in my talk, and one of the things I really like is to be surprised by how readers respond to certain stories. So last year we did a series on changing climate, changing cities, and it was written by Michael Kimmelman, who's our chief architecture critic, not a climate scientist, but it was edited through the climate team. And it focused on Mexico City and cities in coastal China, and Rotterdam, which is nearly half underwater, and Houston, of course. And one of the big surprises that I had from that series, which was enormously well received, we got lots and lots of people talking about climate affecting those cities, was interestingly, the big surprise to me was how much the piece on Rotterdam resonated with people. And that's because that particular piece was focused on solutions. Rotterdam is a city that is nearly half underwater, and they have spent decades focusing on solutions to adapt and mitigate and save their city. And they are now making money by exporting those solutions to other cities, many in the United States. And readers really grabbed onto that to say, here we can together find solutions and solve a lot of the sea level rise and subsidence problems that we're seeing. I thought that was just fascinating.
Yeah, I would echo that. I mean, I think our experience is that the health effects that are going to resonate most are those that affect people personally, but they need to both understand sort of how they're affected by, how their health is affected, but then sort of what they can do about it. I think, you know, people do absolutely need to hear both in the same story, that it's very hard to just have stories that are focusing on sort of the detrimental impacts of climate change without having, and the health impacts, without having the other side of that, which is, and there are lots of things we can do. And for us, it's the we is not just the individual we, but it's sort of the collective we. And I think, you know, we've really been working hard to sort of use this as an opportunity. I think as Administrator McCarthy pointed out, that, you know, this is an opportunity in public health to actually talk about some of the big policy changes that we're looking for and ways to bring people together in communities to advocate for things that make a lot of sense but require policy change as well as individual practice change.
One thing that I think as scientists we struggle with is that most of the evidence, most of our studies are really of large populations in order to sort of generate enough statistical power. We don't often have individuals that we can point to that have stories. So I think we need to think about how we can reframe our work to focus more on individuals, maybe working with clinicians to a larger extent, perhaps, to try to find those stories.
Well, I think I'm a legacy journalist, meaning I'm old, and came of age in a time when these stories that you did were tragedy stories, and that, you know, that's what you thought got people in. There's a new movement called solutions journalism. It's funded with education projects for journalists. Individual reporters are being funded to do it, and I think that we're going to see more of that. Actually, I think that that's really a coming thing. But then I think of stories like disparities. The fascinating thing to do, and of course the way I would do it would be, you know, maybe find a poor kid with asthma and look at it through their eyes. But with this new movement towards solutions journalism, maybe the thing to do is pair that with somebody trying to do something.
Mm-hmm. Great, thank you. And do we have a microphone that's going around? Okay, great. Questions? I guess they're in the back.
My name is George Mocray. For about the last 10 years, I've been publishing a free weekly listing of energy and other events, looking at what's happening at colleges and universities in the local area and what's happening in the community. A lot of that is about climate change, and it's an underutilized resource. A couple of years ago, I heard Justin Gillis from the New York Times speak to the Knight Fellows at MIT, and he had just finished, I think, about 2 or 3 years looking at climate change going all the way around the world. It later became a book. And he said the next project that he was going to do was a similar thing, 2 or 3 years, looking at solutions. I don't read the New York Times every day, but my impression is that that never really happened. And I'm wondering if the New York Times is going to do that, is going to look particularly at solutions like the surprise of Rotterdam and a lot of the things that are out there now. I know that New York Times Magazine did an article on soil carbon sequestration, which is good to see, but to focus rather on solutions than the problem.
Great, thank you. Hannah, that sounds like that's for you.
Sure. Well, as I just mentioned, I had a great learning from last year's big series on cities and climate change, that readers are really interested in solutions, and that's certainly a trend that we're seeing in journalism right now. So it is a focus. It is, however, a great sadness that Justin Gillis is no longer with the New York Times. He left to write books, which I hope you will all read. But we do have other excellent journalists who are, in fact, focused on solutions and solution journalism. I think it's a very important part of our coverage moving forward, and you're definitely going to see more stories. We have ones ongoing right now, and you mentioned the one that was published just last week from the New York Times Magazine on soil and carbon capture within soil, and you're going to see more of that, and I'm excited about it.
Yes, a woman with glasses here.
Hi, I'm Kara Rogers. I work for Eversource in the energy efficiency group, and I take it very personally that so few people raised their hands when they were at the question about air conditioning being a major way to solve climate change, and that is part of my job is to transform how we're talking about energy efficiency. Eversource has been recognized as a leader in energy efficiency, and yet we've done a bad job in communicating that, and I'm also taking the lesson that we can tie in health and, as we're talking about it. So my question, especially to Hannah and Joanne, how would you recommend we start talking more as a purveyor of those solutions? How do we talk about it in a more constructive way?
I love this question because it gets at the personal question of what can I do? Because energy efficiency from consumer choices and consumer purchases, I think, can be really important. I think a lot of us feel like so many of the solutions that we see, certainly on the Rotterdam level, are big solutions. They're policy solutions. And we all vote, and that's incredibly important, but not many of us are lucky enough to be policymakers. But we're all consumers. And so being educated consumers about what we use and how we use it, I think is also incredibly important. And I'm seeing more and more real engagement from readers about the choices that they're really interested in making on that. We get a lot of reader mail every week, and we comb through every single one. And more over the past year, I've seen a lot of people asking, what is it that I can do personally? And that's a great answer to that question.
And I'll take the question from a different angle, and that is, how do you market your story to journalists? And boy, that's changed a lot. You know, back in the day, I'd get press releases, I'd look at the wires, I'd know what meetings were around town. If it was an interesting meeting, I'd go, wires, you know, and then pay attention to the other things. There's such an onslaught of that. It's hard for me to take in. You know, I do look at my email, but you know, when I get the nurses for some reason send me, I get literally, you know, I can't shut them down. I've hit unsubscribe, I've called them, I can't get off their list. Journalists are getting a little bit blind to that deluge. What I'm saying is not going to make anybody in journalism happy, but there are ways to market it yourself. You know, nowadays, having an interesting person who's working in this area have a blog that gets readers, that gets mentioned, somebody who tweets, excuse me, I'm sorry, somebody who gets something, getting something out on the net yourself is, I think, one possibility if you can't get journalists' attention. And the way to get journalists' attention, again, have interesting meetings, have people available, maybe do something, and like all things, you might be dry for a while, but at some point, something will catch on. You know, if you've got an interesting website, if you live stream an event like this, people will start hopefully coming to your website to see what you're doing.
I'm wondering if Austin or Barbara have anything to add about how you bring some of those solutions to your city, your county, if there are programs or activities or educational work that you find is effective.
You know, one thing that we've done in the city of Boston is we recognize that as much as I love giving that presentation, that sometimes that your favorite, you know, municipal bureaucrat doesn't necessarily connect with everybody. So what we've done is we've created a program called Climate Ready Boston Leaders. And this is a grant program, small grants, about $200 that we'll give to somebody. We'll train them how to give this presentation, but then They might be able to give it in a language that I don't speak. They might be able to take it to a house of worship that I don't generally go to. So we're training friends on how they can teach their friends about climate change, how neighbors can teach neighbors, how family members can teach family members. So being able to take some of the success stories and being able to reach that next level of people is a strategy that we've employed for the city of Boston.
Yeah, I think that's actually an excellent suggestion. And you know, I think in LA we're doing something a little bit similar, but taking more responsibility at the department level to make sure there's a community engagement strategy prior to finalizing plans. I think oftentimes we've sort of been, you know, we're gonna finalize plans, then we're gonna take them out, we're gonna kind of sell them to people. I think we're trying to reverse that and actually say, let's go out and talk with folks about what the issues are. Let's listen and hear how folks in our communities feel about those issues, think about those issues, and how concerned they are about those issues and what solutions they would propose for those issues, and get them engaged. Because I think both strategies are about community engagement. There's nothing that we're going to be able to do, certainly from the government side of this, by ourselves. You know, we're going to need a lot of partners, and some of our most important partners are going to be our residents. So I like these strategies that actually put at the heart of the work the imperative to really elevate the voices of the people most affected by the problems and not make assumptions that the solutions need to come only from experts. Because I think we're missing the boat a little bit on how we ought to think about both climate change and improving ecosystems that work well for everyone in our communities.
Can I just want one more? I'd want to add, which is that most of the there are a number of professional societies that journalists have, Association for Healthcare Journalists, Society of Environmental Journalists, and they have big annual meetings. And boy, if you can get on the program of one of those meetings, you know, contact those places and say, when's your next annual event, and how can is there a way for me to pitch a topic? Usually, at least with AHCJ, which I'm active in, they ask members to promote topics. I'm not sure they'll take outside ideas, but it's worth a try. And if not, if you've got a reporter who covers you regularly, you can say, hey, why don't you suggest? Because that's the way to reach journalists directly that's going to get around the press release phone. Don't ever call. That just doesn't work. But even the press releases now don't work so well.
The Society for Environmental Journalists meeting this year is in Flint, Michigan. And that's a good place to talk about public health.
Great.
Great. Let's see. We have a question back here.
Just following on that, I'm in
sorry.
conversation with Secretary in Boston and a member of SCJ. You can also attend the meetings. You can exhibit at the meetings. There's lots of ways to get to these things and meet people. You don't have to be on a panel. That's good, but there's lots of other ways you can do it.
Thank you. Question for our panelists.
I'm Roberta White, former chair of environmental health. And my experience in getting people to act when we have huge public health problems like climate change really comes from toxicology, from exposure to chemicals. And I have found in my many years of doing this that the way I have gotten to the highest levels of government, the way I have gotten the best communication really relates to what Barbara was talking about with community engagement. But it's not been just me going to the community. It's been the community coming to me. And usually the community in these situations has been victims of a chemical exposure or some kind of environmental hazard. And I'm sure we have victims now with climate change, and maybe some of them have organized into advocacy groups. They can be very, very powerful. At least in my experience, I think that's where I've gotten laws changed. That's where I've gotten money for people. And I'm wondering who those groups are in the climate change area.
I mean, I totally agree with you. I mean, I think of climate change as an environmental justice issue. And I think for people in communities, it is an environmental justice issue at its heart. And I think that you're right that it is about making sure that we're listening and that we're putting ourselves and making ourselves available. You know, those of us who are in government, even in academic institutions, I would say it's very similar, to be of service to those communities, because really often what's missing is their access to really good information. And sometimes we're the ones who are really, sort of the guardians of that information, or have the means and the resources to help make sure that they're getting the kind of information that helps them connect the dots. I do want to say, this issue about, sort of policy change and how does everyone get involved. I really do think everyone can get involved. I know in LA County right now, there's a ballot initiative that's about to be unveiled that would actually increase taxes for all homeowners to really help with stormwater reclamation projects. And water is a really big issue in LA. There's overwhelming support for this because people have tied it to both environmental justice and health. So the need for there to be, sort of an adequate supply of safe water is in everyone's interest. And even, this is what, where I think, we've sort of missed the boat a little bit is people are in fact willing to pay a little bit more through their taxes in order to ensure that their health is protected. And I know it comes as a surprise sometimes because we constantly hear this message around it can't have an economic, any kind of short-term economic impact. But I think people in communities are way smarter. And they basically get that their health is essential for their economic well-being. And they've made that connection. And they want to make sure that services and supports and policies allow them to, in fact, have those opportunities to be healthy. So I don't think we should undersell our communities, which is what I think you were saying so eloquently, is people in communities can organize, do organize, and often actually need us to be supporting their efforts.
Pat, I'm curious, as a researcher who's trying to conduct research and get papers published and that sort of thing, how do these ideas of more time spent on engagement strike you, and do you have examples from your own experience of that?
I think it's a really, really interesting point, which I'm glad Bobby brought up. And I was thinking, as you were talking, I was thinking back to some experiences I had working in New York on diesel pollution with residents of Harlem who were concerned about the asthma rates in Harlem. And the work we did together on measuring air pollution in New York City and showing the impacts of diesel depots and the bus routes ended up having a really big impact on policy at the federal level. I mean, at least it was one thing that people pointed to and said, this is evidence that, and having the community partners who were really good at advocating, sort of helped amplify the scientific voice as well. So it's a good point.
We have time for a couple more questions. Let's see. Let's go over to this side of the room. We haven't been over there yet. You can please introduce yourself.
I'm Hannah Bernstein. I'm a student at Northeastern. I'm studying journalism and environmental science. And we've talked a little bit about both environmental justice and solutions journalism, but I kind of wanted to merge them. I'm curious both in research strategies for researching and providing data in regards to those marginalized communities dealing with environmental justice problems, and also in journalism, how we can intentionally uplift the voices of marginalized communities, particularly communities of color, in our environmental reporting.
So where do you go for information about the impacts of climate change on marginalized communities? Is that your first question?
Yeah, curious about strategies from both a research perspective and a journalism perspective. How can we be better?
Anyone want to take that?
I would just say we could be better by doing more. I'll leave it at that.
Shoot me an email. I'll be more than happy to share with you some of the work that we've done on that as part of not only Climate Ready Boston, the vulnerability assessment that we did that produced those graphs and the numbers, but as well as Boston's first master plan that we've done in over 50 years called Imagine Boston 2030. We took not only environmental justice into account, but also equity into account. We actually had a chief resiliency officer who really led a conversation about race in the city of Boston and what that meant for us as a resilient community, not just from an economic perspective, but also from a social social perspective. So more than happy to share with you some of the research that we've done, but I agree. It's something that, unlike climate planning that has strong frameworks that the city of Boston has been able to share with other cities across the nation and across the globe, how to get started, get off your feet, hire staff, understand what your greenhouse gas inventory. The work around equity and social justice and environmental justice is still kind of in its infancy. And so we're trying to work through how do we come up with that framework so that we can share it as well. And I think you're right, it deserves a lot more attention.
On the journalism side of things, one of the things that concerns me very much in the United States is the shrinkage of local journalism. There are several large national newspapers that are doing okay right now, but there's a lot of local papers that are not. And a lot of those important stories that you're talking about, cities smaller than Boston who are researching this and have plans and working hard on it, those stories are not able to be told because there just aren't small newspapers anymore. And so to fill that void, I think we need to think a lot more about community voices building those stories, because there's not daily small newspapers anymore that are, but there are blogs and there are podcasts and there are lots of other ways to tell really important stories. And locally, I think that that's something within the next few years we're going to see a lot more movement on. At least I certainly hope so.
One of the strategies that we're trying, and again, we're just starting to try it. I'm not sure that it's going to be as effective as we're hoping, but we're trying to sort of open source our data more. In two ways. One is we're going to neighborhood profiles. So we're going to LA County has 10 million residents. It's got like 84 cities, 104 unincorporated areas. It's huge. And there's no way the county data actually captures the stories, particularly stories around inequities and the distribution, the unfair distribution of resources and opportunities. So we do need to get to the neighborhood level. So we're trying to we're struggling with doing these neighborhood profiles, but instead of issuing sort of our reports, we're actually going to do these sort of preliminary reports that are going to be on a web-based platform, and we're actually investing in having staff that will work with community groups in all of the neighborhoods so that they can actually add to that data or ask us to help them add to that data. So for information that's missing, particularly around the context in which people live their lives, we're going to be looking for help from all of our community partners about what that data should look like, and then can we provide technical assistance so that they can load it up, and then they can issue whatever report they want to issue. In other words, we don't really own the data. I think a lot of times, we've fallen into this trap of, we analyze the data, it's our data. Most of the data that we're collecting at the health department actually comes from people who live in our communities. It's really their information. And somehow we need to get back to figuring out ways that they're able to have that information, have easy access to that information, present it in ways that make sense to them and tells the stories that they really feel represent the authentic narratives of their real lives. So, so I appreciate that question. I think it's really hard to make decisions on what information people need to be able to tell the stories about how their lives are organized and how their communities are organized and where they want to go to create those healthy communities without really having a much stronger partnership and set of collaborations with, particularly in this case, residents and community-based organizations.
So I think we need to wrap up our panel discussion here. But I just wanted to do a quick recap around this idea that climate might just be a huge opportunity to enhance well-being in our communities and to address public health issues. And I think we heard many great examples here from our panelists, from training leaders to be messengers within their own communities, to trends and solutions-based journalism, to engaged and responsive science, and to outreach that puts people first when even developing these plans and thinking about how to communicate them. So I think those are some examples of real things that we've learned from all of you this morning. So thank you for sharing your wisdom with us, your examples with us. And please join me in thanking our panelists for